Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thank you so much for joining me. Please, I ask you to subscribe, like the video, and ring that bell. I appreciate your support and it helps this channel to grow because I want to give you useful and helpful information to empower you to learn about your own bodies. Today we're going to talk about a fissure commonly done for anal fissures, and let's talk about whether it's helpful or not, what the recovery is, and whether you can get another fissure even though you've had that surgery. What's my recurrence rate is that word that comes up a lot. So the first thing, we have to break down that procedure name, which is Lateral Partial Internal Sphincterotomy. Really long one. Lateral means the side, which is usually done on the left side, and partial means only a portion of the internal sphincter, so the inside muscle of our control down on the bottom of our bottom ends, right? And sphincterotomy means to cut that muscle. So we're cutting just a small portion of that muscle. And that procedure is usually done in a surgery center outpatient setting. So you go in the surgery center and you usually go home the same day. Surgery usually takes about half an hour or so, just depending. And usually it's just one small cut that you see on the outside of your bottom end. You might or might not have stitches there, just depending on your surgeon's way of performing that procedure. But overall, the surgeon will find that internal muscle, internal sphincter muscle in the surgery. Usually it's a pretty thick piece of muscle because in anal fissures we know that the internal anal muscle is the culprit, and it's just squeezing down with all of its might, preventing blood from getting to that anal fissure cut wound, and that's what makes it stay there for so long. So that really thick and powerful muscle is now divided, usually to the length of that anal muscle, and about usually a centimeter or less of length. And after that, the procedure is essentially done. Now we release that muscle. It isn't able to contract it anymore. At the same time, if you think about it, the muscle is destroyed. It's been essentially released of its duties. You know, it used to be able to squeeze where it was cut. Now after that cut, no longer is it able to squeeze back again. It's always going to have that part that's broken and therefore isn't able to contract as hard as it used to. Then the surgeon will stitch up the skin. He may or may not, just depending, and the surgery is done. Usually they'll also insert some pain medication, some injections to help with the pain afterwards, but that is really the procedure, and you go home that same day. When I perform the procedure, I usually put in some stitches in there, but really it's pretty straightforward. The identification of the muscle is very important because you want to divide all that muscle there. Next, what's the recovery like? Well, the recovery can be difficult because it's on your bottom end, right? Any cut on the outside of your anus, especially where all those specialized nerves are, very sensitive nerves, high quantity, is going to send that alarm, a really distressing call to your brain and say, there's something wrong with you and your bottom end. You should probably go look there because there's something going on, right? All that inflammation and that injury that's caused from the surgery is going to be a part of that recovery. Thankfully, it's not as bad as doing like a hemorrhoid surgery, but pain is a very subjective experience. Some people, very stoic. Other people, they're very sensitive to pain. And so the amount of pain medication that one may use, whether you're on one side or the other, are going to differ, right? And that's why our experiences are very different, and therefore our stories. And you don't want to do any heavy activity immediately after the surgery. Like, you don't want to go work out in the gym and do a ton of maxing out or 50 sit-ups or anything like that. But I always suggest walking around, doing stairs is safe and advisable. You don't want to just be laying in the bed all day. You do want to get some activity. Because what's another thing that needs to be mobilized is your intestines. If you just lay around all day, that's a bad setup for constipation. And believe me, your stools do not want to be hard in this situation, because if you have hard stools rubbing against your bottom end, ooh, you're not gonna like that one bit, I promise you. So definitely talk to your doctor about getting stool softeners. Talk to your doctor about how your stool textures can be optimized during your recovery so that you don't have to suffer so much after a bowel movement. But really, the wound, in terms of wound care, the body usually takes care of itself. The anus, believe it or not, is very used to seeing poop 24/7. The bacteria is there 24/7. And so just doing sitz baths and occasional washing there is all that it really needs. And you don't need to be scrubbing with soap on the bottom end or really being very, very clean down there and scraping and scrubbing all the time. It's really not necessary. Just a sitz bath or a shower. Open your butt cheeks. Let that water run down. And that's really the amount of cleanliness that it really needs. I always suggest that people put a 4x4 gauze, so like a little square gauze that you can buy in the drugstore, fold it in half, and just place it on your anus and your bottom end and let your butt cheeks just close after it. It'll hold that gauze in place. Sometimes if you need tape, you can do that too, but it'll also soak up any of the drainage, any of the blood, or some of the liquid type of material that may come out of there, because you've got a wound that's healing there. So your skin then won't get all irritated from that chronic moisture, and it just makes you more comfortable, makes you feel cleaner, and it's super easy to clean up because you just pick out that tissue, throw it in the trash, and put a new one right back in. Every 3-4 hours or so is really how often you need to do it. Towards the end of your recovery, once that wound is closed up pretty much, then you can start changing it less frequently because there isn't as much drainage coming out, right? I say after about 2 weeks, people are really starting to feel much better after the surgery, and that's when I tell people, why don't you start gradually increasing your activity? So start working your way up. Maybe use some light weights when you're at the gym. Maybe start doing some longer walks as well. Gradually start ramping up and then start running if that's what you normally do. But definitely be patient and do things little bits at a time. So don't go from walking around your house maybe 50 feet to now walking all of a sudden half a mile, because the soft tissue around your anus really starts to rub together, and if it's not used to it with all that new scar tissue there, you may be kind of unhappy when you get home after you rest a little bit, because things might feel really raw and you may regret doing that much at that time. So step it up slowly is what I suggest. Now, after you recover from that surgery, or excuse me, about 2 to 4 weeks, you'll probably see your surgeon again in the office. And so definitely discuss with your doctor about how your wound is looking, how you're feeling, how's the pain doing, because then we want to talk about what about recurrence, right? What are the chances of this fissure coming back? And usually this surgery is actually quite good at healing the fissure that you had before the surgery, or the reason why you had the surgery, right? And the chance of it coming back is usually about 6 to 8% of people do. Now that's not a chance, that's just in an average of 100 people, about 6 to 8 people will get another fissure there. And so I think that for this reason, right, those 6 to 8% of people, in my opinion, what they really needed is they needed to have their habits looked at before they went into the surgery. Because some people, it's about how strong that muscle is, and that surgery treats things, and so it doesn't happen again. But other people, it's a lot more difficult than that, and they keep getting them over and over again. And I've spoken about this in previous videos, but I have not done this surgery in 5 years, and I've healed so many anal fissures. I mean, even fissures that have been there for a year. And I find that the surgery is not quite the total fix that it's touted to be. In my opinion, number one, habits, stool softening, other factors, and I have a 5-part series on anal fissure treatment. Please go look at those, I invite you to. But with that whole therapy and the creams involved, that is what sets people up for success in the long term. When you ask people would they rather have surgery or not have surgery on their bottom end for fissure, pretty much in my office anyway, 100% say I'd rather not have surgery if I can help it. And so when I teach people these things and instruct people and recommend these treatments, I'm very successful, and I'm just so thrilled to see it, and you bet the patients are very happy about it too, right? And the other thing is about the surgery is incontinence. When you're cutting any muscle, you weaken the function of it. And with the anus, we have to think about the chance of leaking gas or stool without our control. That's what's called incontinence. And that's very distressing because we're very self-conscious about how we smell. We're very self-conscious about our cleanliness, and we don't want that happening. What's the chance of incontinence with this surgery is about 7%. And given that number, it's not something, it's low, but at the same time, you don't want to be one of those people to have that complication, right? So in my opinion, another reason why surgery should be used as a last resort, and another reason why you should definitely have a long and thoughtful discussion about that surgery so that you understand the risks going in and what possible benefits you're going to have with it. And for those people that have had success stories with that surgery, I fully congratulate you. For sure that was, if you're having success and it worked, then that was the right treatment for you, right? And you are truly able to live that life that you that gives you that full quality of life, and I applaud you for that, and I congratulate you for that, because not many people can say the same thing, you know. Not everyone can say that, and so you truly are lucky. But you can do everything that you used to do. What I would say is continue those good habits to keep your bowel movement soft, and keep all those good habits in place when you are doing the bowel movement. Treat your bottom ends right, and they will thank you for it, and you guys can be friends, your bottom end and you, right? And I hope this video helps you understand the anal fissure surgery, the lateral partial internal sphincterotomy, and a little bit of background about the recovery and about the possible complications. Thank you so much for listening, and I really appreciate you being here with me. Definitely comment below, ask your questions, and a new video will be coming out soon. Thank you so much, take care, and goodbye.